This is not the first time viewing the video Chasing Zero, and yet it still has a profound impact on me. The video brings to light that there are healthcare mistakes that occur in every day and that can have devastating outcomes. There are many factors that go into those mistakes happening: nursing fatigue, oversight, dosage mistakes, medication interaction, just to name a few. One of the takeaways or lasting impressions that the video had on me is that we as nurses need to go back to the basics, which is evidence-based practices. These evidence-based practices have provided us with the practices that provide the patients with the best outcomes. The one practice that I feel very strongly about is the 6 rights of medication administration. As nurses, I understand the pressures that we face to meet the needs of our patients every single day. Watching the video Chasing Zero was a brisk reminder of what could happen if you don't take the time or if you're not fully present that shift. The result of making mistakes will forever be with you and heartbreaking for everyone involved. Organizations such as the Institute of Safe Medication Practice is a nonprofit that continues to investigate new ways and practices to reduce medication errors and improve practices. I witnessed an error at a hospital a couple of years ago. A medication error was given to a woman that was in early labor with twins at 28 weeks. The nurse had given the wrong medication. Instead of slowing or stopping contractions, medication was given that induced labor. This particular night was quite busy and the nurse had several patients. The nurse failed to follow up with the patient in a timely manner, and when she entered the room, found the woman's labor very progressed. The woman gave birth to 2 babies, and unfortunately the babies had many complications due to being premature. Both of the babies did not survive. Witnessing the family and the nurse go through the pain was unbearable. It will forever stay with me, and I suppose this is the same feeling Dennis Quaid had, and the reason why he continues to advocate for changes in healthcare to decrease these medication errors. Throughout my nursing schooling and career, I have been constantly reminded of the ever-evolving nature of healthcare and healthcare practices. It is not always an exact science, but our nursing practices are in place to care for patients to ensure that we are giving the best patient outcomes. These practices also involve providing nurses with proper training, support, and care to be able to provide the patients with the best care. I would like to encourage you to continue to advocate for your patients, but to also advocate for yourself and to advocate for your fellow nurses. We need to make sure that our nurses have good patient ratios to be able to provide the proper evidence-based practices. It is my hope that this will have a positive impact on reducing medication errors. Thank you.